Supporting people's mental health needs many organisations to work together. Working in partnership across health, social care and the voluntary sector means that together we can better support the mental and emotional well-being of communities in Norfolk and Suffolk. In today's film, you will hear more from colleagues in primary care, in West Suffolk Hospital, and a patient who volunteers for Get Me Out of the Four Walls about the benefits of working together in partnership. Primary care are seeing a steady increase in patients presenting to general practice who need support with their emotional health and well-being, and this is only likely to increase in line with what we've seen through COVID. In this example, we will hear about mental health practitioners who are based in general practice and who provide a vital support to GP colleagues in better supporting those with mental health and well-being needs.
I was one of the first primary care mental health nurses in post, as Wharton was the pilot site. But since the beginning of this year, there are primary care mental health practitioners covering most GP practices within Norfolk and all the primary care networks.
Having a mental health worker working alongside our GP team has helped the patients that we see in a number of ways. They tend to have more time with our patients. Us as GPs tend to have quite a long list of patients to get through. Sometimes those consultations could be 10 minutes, and even if it is mental health, we tend to struggle to be able to give them more than the 10 minutes time.
I offer 40-minute appointments. One thing I've found from working in the GP practice is that people have really valued the amount of time that I can give someone. Another benefit to patients coming to see me in the GP practice is it's local, it's familiar, it's an environment that people have usually visited before, so that puts people at ease in itself.
Liaison Services at acute hospitals play a vital role in supporting individuals who present with both general and mental health needs. We work in partnership with acute hospitals across Norfolk and Suffolk in offering liaison services, but in this clip you'll hear particularly from colleagues at West Suffolk in how they work together to support our local community.
Our service back in October last year got funding to go to the full Call 24 model, which is a 24/7 psych liaison service. So that means that anybody can attend the hospital at any time of day or night and have a mental health assessment.
The benefits of having a psychiatric liaison team 24/7 is they will see people within an hour, so the response is really, really quick. We're also getting a lot of referrals from the ward for people that are depressed or anxious, are displaying behaviour that's challenging, or the ward staff need advice on.
Culturally, within society, everyone knows they can attend A&E at any time of night or day and that they will be seen by somebody, whereas that isn't the case sort of in GP surgeries, or if you attended like where the mental health secondary care teams are based, it doesn't guarantee that someone will be available to see you. It is also helpful if that anybody does have any sort of physical health need as well, so whether if that's that they have harmed themselves or whether they've actually got a condition that they're not managing very well because possibly of their mental health, so when they come into the hospital they can then have their physical health and their mental health looked after as one.
The West Suffolk location has helped the teams because we're all on site together. So it's about building the relationships, having that visibility and being one team together to meet the patient's needs.
The COVID pandemic has shown us just what a vital role colleagues from the voluntary sector can play in working together with us to support the needs of our local communities. In this clip, you'll hear from Charlotte and Kelly and their experience of the benefits of working together in partnership.
Being an ambassador for Get Me Out of the Four Walls gave me the opportunity to give something back to mums and dads through my own journey of becoming a mum.
Most of those organisations that we work with are born out of people who have struggled to find the support they need in a time of crisis, and so most of the staff that we work with are passionate about what they do. I think people forget the voluntary sector, and I think the last year has proved that they play an integral part of support in Norfolk and Suffolk. They're offering peer support, social meets for mothers on discharge or whilst they're in the mother and baby unit. It's offering that continuity so that they can start building those connections in the community. It's something sort of concrete that they've got.
Charlotte has been a patient within the community team as well as the MBU, and what's been really nice is that she has now become an ambassador. So sort of for me, talking about my experience and how that sort of helped me has empowered her to become an ambassador and help other mums as well.
I was first admitted to the mother and baby unit in April 2020 during national lockdown, which made this a lot harder. I didn't realise I was unwell, however the staff, psychologists and doctors taught me about my illness and taught me how to manage my symptoms to live a better life. After I was discharged, I learnt about Get Me Out the Four Walls. I just wanted to be part of it and help others, and I can use my experience to help others, and it's amazing.
I think as a mum, I think in any sort of situation in your community can be either quite overwhelming or quite isolating. So, you know, you might have lots of places to go to or none at all. But I think having places to go to, I think it needs to be a safe space in terms of not feeling judged, and when perhaps maybe you're not feeling that at all, it's really important, I think, to gauge those relationships with people that are going to understand your needs.
When we talk about the VCSE, they, you know, when somebody leaves our care, they're there. When they come into our care, quite often they're there. And during, quite often they're there. So I think they play a really vital role as a holistic approach and continuity, and help with the transitions.
I'm sure you'll agree that the examples that we've heard today really give us a sense of how working in partnership together can better help us support the needs of our local communities. We think this is a vital part of how we need to work going forwards to better support everyone with their mental health and well-being.